Joining us now is Volunteer Vice President of the Medical Initiative for Africa, Ebuta Neji, who will be talking more on flattening the curve and cost-effective operation in combating the coronavirus. Thank you for joining us at this time. It's just pretty amazing how fast and how increasingly the numbers are across the globe. As we speak right now, we're looking at 1,083,000 plus active cases across the world. Well, some would say that the good news is that 96% of these figures are in mild condition. How do you begin to react to all of these latest figures?
Thanks a lot for having me. What's interesting is that these figures would continue to increase significantly until a percentage of the populace are being infected with SARS coronavirus 2. Subsequently develop some level of immunity that will allow them to continue their lives as usual. So the fact is that as it concerns us, Nigeria, we need to be able to contextualize it and say, what are the steps we need to take? If you look at the concept of flattening the curve, which most people are talking about epidemiologically, what you aim to do is to reduce the number of patients who are presenting in your health facilities at any point in time, so that you can reduce the pressure on the facility. Basically, it's common sense to assume that the number of patients who present in your health facility at any point in time will depend on the rate of infection. So if your health facility has a capacity to handle maybe 5,000 patients and you have over 10,000 patients, the pressure will be too much and the health capacity would suffer a collapse. So the aim of measures to control increased rate, those are basically targeted at reducing the number of people who have it, so that the number of cases presenting at any point in time will go down. That's what you talk about, flattening the curve.
You shared a graph with us, Doctor, talking about how protective measures and non-availability of protective measures have affected the cases. Can you shed more light on that?
Yeah, essentially, some of the measures that the government has put in place, like the lockdown measure, the issues of measures like social distancing, hand hygiene, cough etiquette, case identification, early testing, tracking of patients, and isolation and quarantine are very important, because these are the measures that will slow down the infection rate and reduce the rate at which people will develop conditions and require interventions. However, the health system has to be at a level that can absorb these people. So whatever measures you are putting in place that brings down the rate at which people present, your health system has to meet it up. One of the measures that the government may not really have considered, but which is incidentally controversial, is the issue of universal use of face masks. Countries like China, Hong Kong, Thailand, the Czech Republic, and a couple of other countries have instituted, and the United Arab Emirates have instituted the fact that everybody should use face masks when they leave their homes. This is based on the assumption that there are certain percentage of patients or people who have the SARS coronavirus 2, but do not have any symptoms. So these are said to be asymptomatic. Unfortunately, these people, when they talk, when they cough, when they sneeze, can transmit.
But that particular position, Doctor, simply contradicts the position of the WHO in a document it published on the 6th of April. I'm going to quote a bit of it for you. They're saying that, of course, the WHO actually is maintaining that while the use of masks could help limit the spread of the disease, they are insufficient on their own, and that there is no evidence whatsoever that wearing a face mask in the community prevented healthy people from picking up respiratory infections. According to the World Health Organization, nothing beats hand hygiene, maintaining social distancing, and many of the issues that have been earlier discussed.
So social distancing and high hygiene, excellent. But the WHO also tells us that, look, if you have a patient who has a coronavirus infection, this patient should use a face mask to prevent transmission to other people. WHO also says that if you have a health worker who is in close contact with a patient, or you have a caregiver who is in close contact with a confirmed patient, this person should also use face masks. It is confirmed, even when you manage patients with tuberculosis, you want to give those patients face masks so that they don't transmit. It is important to remember that probably out of maybe 1,000 SARS coronavirus infected patients, 500 may not have any symptoms. So they are out there in the public, they assume they are fine, and they do not have any symptoms. But when they talk, when they cough, when they sneeze, they transmit this infection. You must also understand that WHO takes decisions through a very organized process. They take decisions after several meetings, study protocols, evidence. Sometimes this evidence is slow to collect, slow to implement, slow to integrate. And then when you look at some of the decisions or some of the reasons why WHO has said that you cannot use masks for everybody is because it is claimed and is rational that if everybody is using masks, the few masks that are produced and that are available will be used up, and then the health workers
will not be available for health workers and those who need them. We might have to wrap it up there, Doctor.
So we are saying that just like the Czech Republic recommended, people can use their homemade masks because we don't know who doesn't have. About 50% of the patients who have this infection are symptomatic and they don't have infection, they do not have symptoms. So if they use a face mask, they can reduce that proportion, that infective droplet from leaving out. The second thing I would also want to make up to wrap up is that when you are looking at flattening the curve, you also have to look at increasing your health system capacity. So we are probably going to buy between 1,000 to 5,000.
I know you have quite a lot to share with us, but I'm afraid that's how much time can permit us. Volunteer Vice President of the Medical Initiative for Africa, Ebuta Neji, thank you very much for talking to us.